Hello friends, welcome to Pharma Associates. Myself Ram Ayluri, a senior quality professional. This video carries 15 self-evaluation questionnaire on the said topic. You can check your knowledge score on the topic and please comment the score you attain after watching this video. If you score 13 marks and above, you have very good idea on this topic. If you attain 10 marks to 13 marks, you have fair good idea about this topic. If you attain below 10 marks, you still need to refine on the said topic. All the best my dears, and here we go. Which guidance document talks about clean rooms and associated environments? ISO 9001-2008, ISO 14644-1, 21 CFR Part 11, 21 CFR Part 210. Correct answer is ISO 14644-1. Cleanliness of classification 1 lakh as per US is under which classification as per ISO? Class 8, Class 7, Class B, Class D. The correct answer is Class 8. Which of the following are performed during PQ of HVAC? Physical verification of the system installed, calibration of the gauges and instruments, verification of dimensions and MOC, particulate count. The correct answer is particulate count. Which of the following not required during PQ of HVAC? Air changes and velocity, recovery time, leak test, airflow pattern, viable and non-viable, none of the above. Correct answer is none of the above. Which of the following not required during PQ of HVAC? Differential pressures, temperature and humidity, airflow pattern, viable and non-viable, none of the above. Correct answer is none of the above. Correct procedure for air velocity test is measure at 4 corners and center of the filter and average the reading, measure at center of the filter, measure at the door entrance, none of the above. The correct answer is to measure at 4 corners and center of the filter and then average the reading. Formula for air changes per hour. Total CFM of the room into 60 divided by volume of the room. Total CFM into 60 divided by area of the room. Option C, both the above. Option D, none of the above. The correct answer is total CFM of the room into 60 divided by volume of the room. Non-viable particulate count test is done with anemometer, airborne particulate counter, settling plate technique, aerometer. The correct answer is airborne particulate count tester. Number of locations to be sampled for non-viable particles if the area is more than 1000 square meter. Area in square meter divided by 1000, area in square meter divided by 100, area in meters divided by 1000, none of the above. Correct answer is area in square meter divided by 1000. Maximum number of 0.5 micron and above particles allowed per meter cube is 350,000 at rest condition. Then the area comes under Class D, Class C, Class B, Class A. As per WHO, the correct answer is Class C. As per ISO class 14644-1, if 0.5 micron and above particles present below 35,20,000, then the area is Class 7, Class 8, Class 6, none of the above. Correct answer is Class 8. As per ISO class 14644-1, if 5 micron and above particles present below 29,300, then the area is Class 7, Class 8, Class 6, none of the above. Correct answer is Class 8. What is the limit for activate microbiological level in Class 8 area as per USFDA guidance? 100 CFU per meter cube, 50 CFU per meter cube, 10 CFU per meter cube, 5 CFU per meter cube. The The correct answer is 100 CFU per meter cube. What is the limit for settling plate in class 8 area as per USFDA guidance? 100 CFU per 4 hours, 50 CFU per 4 hours, 10 CFU per 4 hours, 5 CFU per 4 hours. The correct answer is 50 CFU per 4 hours. What is recovery time? Time required to maintain back the clean area condition, time required to switch on all the AHUs, time required to maintain temperature, none of the above. The correct answer is time required to maintain back the clean area condition.